Hello, my name is Kathleen Lopez. I'm going to be doing my windshield presentation on Redlands versus Rialto. Rialto is where I live, and Redlands is where I work. So the demographics, the population of Rialto is about 80,000. The median age of the population is 28. The population under 19 years old is 35%. However, the biggest population category is 25 to 35 at 14.4%. The population and the median housing income is $45,909. 22.5% live under the poverty level. In the city of Redlands, the population is 68,747. The median age is 35.9, which is about 6 years older. 29% of the population is 19 and younger. The population is much more equal across the board, and there's actually more older adults than in Rialto. The median household is significantly higher, about $20,000, 65,200, and only 14.4% of the population lives below the poverty line. So the borders, Rialto borders Colton, Fontana, San Bernardino, and Bloomington. Redlands borders both Loma Linda and Yucaipa and Highland. So the appearance, right off the freeway, these are both right off the freeway. I saw like both kind of unkept abandoned lots. However, the one in Rialto had more trash in it, and the one in Redlands was kind of more cleaner. The housing. So the housing is actually significantly different. Redlands has very large houses. They're very nice, very secluded. The yards are manicured, and there's a lot of foliage around it. Rialto has some very nice houses, but there's a lot of houses mixed in that are not well kept. The grass is, the paint is peeling. It's faded. There's water damage on the outside. There's not well kept grass that is growing out of control. Rialto actually has quite a few mobile home parks. And the difference, Redlands does too. Redlands are so much nicer. They actually look like houses, whereas Rialto's kind of, not all of them are really well kept. Redlands had a lot of multi-home dwellings, apartment buildings, and so signs of decay. I saw most signs of decay in Rialto. There's just abandoned fields, but they look like they were meant to be abandoned on purpose. They're kind of like nature, and just letting it grow. There's not a lot of trash or anything in the the lots that don't have anything in them. However, Rialto, you can see I was driving in an alley and I found like a bunch of trash, a tire. These chain link fences are like kind of caved in. So the people the people in Rialto appeared a little bit more larger. There were more obese people in Rialto. I did see people walking back and forth in both. In Redlands, it looked more like it was walking for exercise rather than just to get around. Rialto is predominantly Hispanic. I saw a lot of different kinds of people. I saw white, black, um, Middle Eastern, whereas in Redlands, I mainly saw just white. So the health behaviors, as you can see, I took a picture of someone in Redlands on the bike. I've seen a lot of bikers, especially when I get off work in the morning, and I see a lot of walkers and joggers. Rialto, I don't really see a lot of people moving around for exercise, at least. However, they have the farmers market every Wednesday to give local produce and They actually will accept food stamps at this farmers market. And I do see people in Rialto on bikes, but it's more to get around rather than for exercise. So risk behaviors, I saw a lot, not a lot of smoking, but I did see no smoking in Redlands, and I saw like a few people smoking in Rialto. And Rialto also has a lot more liquor stores that are pretty full. There's a lot of people going in and out. Um, so services, so both of them have a lot of parks. Rialto has approximately 9 parks. It has a community theater and a fitness center, a pool as well, community pool. As you can see, those are some of the parks on the left. Redlands has 14 parks and a nature sanctuary. It also has a country club, and there's a lot of trails. This is the Orange Blossom Trail that goes through the orange groves. So transportation, um, there are a lot of driving both in Redlands and Rialto, but there's a lot more people on bikes. Um, Rialto has the Metrolink as well that connects Rialto, San Bernardino with LA. Rialto and Redlands are both part of San Bernardino County, so they both have the bus routes that go through both cities. Uh, However, Redlands has only 3 routes, and it doesn't cover the entire city. Whereas Rialto, because it's kind of in the middle of 2 cities, it connects Rialto with all the way to Ontario, which is like 15 miles away, all the way to Redlands. So a lot more people use buses in Rialto to get to work. So the health and social services. Rialto doesn't have a hospital in the city. It has one right on the border in a neighboring city, but there are a lot of different clinics and doctors' offices and urgent care centers in Rialto that are available. This is one of the clinics available in Rialto, the Metropolitan Clinic. Redlands has the only 4-star rated hospital by the Centers of Medicaid Services or Medicare Services. It's a designated stroke center. It has a spine joint institute, and it's expanding. Um, Redlands also has a lot of post-acute skilled nursing facilities, dementia care facilities, and doctor's office and local clinics as well. So the protective services. So there are 4 fire stations in Rialto, and Redlands has 4 fire stations as well. Redlands has nicer fire stations. I didn't even know this was a fire station when I drove by. I just so happened to see the fire truck outside. Um, Redlands has 2 police stations, and Rialto has 1. So religion, Redlands has over 21 places of worship. I drove by at least 7 of them. This is one of the nicer ones. Rialto has a lot of churches as well. This is one of the ones that's near City Hall. So all of the churches I've seen in Rialto, they're mainly Christian based, whereas the churches and worship centers in Redlands, there's a um, uh, Jewish temple and an Islamic mosque, and they have different types of Christians, including Catholic, Seventh-day Adventists, Baptists, and non-denominational. So the stores and shops. So Rialto has a shopping center that was just built in a super Walmart. It's still being developed. The Walmart is open, and there's a lot of different stores that are going to be opening around it. Um, Redlands has a lot more upscale department stores. It has a theater, two theaters actually, a variety of places to eat. Uh, Downtown Redlands is actually very, very busy all the time. If you look into the picture on the right, there's a lot of cars there. It's always packed. There's always a lot of people um, just kind of walking around downtown Redlands to go to bars and different things. It has a very active nightlife. Rialto doesn't really have that. They don't. A lot of people don't really walk around at night. There's not really a congregation place where people get together. They do have a couple bars, but they're not really well known places to go. Rialto, just like Redlands, will hold different events and the communities will get together that way. Um, Rialto has three Stater Brothers, Walmart Neighborhood Market, El Super Cardenas, Superior. Redlands has Vaughn's, Stater Brothers, and I think that's really it with Redlands. I think they have a Walmart neighborhood store as well. Um, the business and industry. So in Redlands, there's a lot of different businesses that appear to be catering to the older population. There's chiropractic services. There's funeral homes, mortuaries, a lot of skilled nursing facilities, senior centers, senior living places. There is an Amazon warehouse in Redlands as well in Rialto too. There's a lot more small businesses in Redlands, and they appear to be doing a lot better. Rialto has a lot of uh, empty buildings that have been empty for a while, and it's difficult sometimes for Rialto to fill those places. So the signs of poverty and wealth. Rialto has much more humble homes. Um, there's a lot more Section 8 housing, but it's generally really nice looking. Um, Health issues. So I did the health issues according to my stakeholders. So Amanda, who is an RN in Rialto, she stated some of the health issues that are common that with people that come to her. So diabetes, hypertension, COPD, and obesity. Um, so Gail at Redlands Community Hospital let me know some of the common people that we see there: dementia, stroke, chronic pneumonia, and diabetes. So the stakeholders, I interviewed Gail, the stroke coordinator at Redlands Community Hospital. She stated through a community needs assessment done by the hospital, identified vulnerable populations that includes elderly, the uninsured, and working poor. Although Redlands is a more affluent community, Gale identified areas of unmet health needs and problems, including healthcare access, availability, and cost for elderly, uninsured, and underinsured for the working poor. So Marianne, the nursing case manager at Redlands Community Hospital, stated that we need to have more public education and expand the already existing community case manager program that help prevent hospital readmissions. So Redlands Community Hospital currently has a community case manager, but it's only for certain patients who have certain insurances. And she she thinks that if we had a one that kind of went to everybody, then we would be able to help more people that way. She states that at Redlands Community Hospital, there has been a significant increase in the readmission rates of patients with COPD and congestive heart failure. So my stakeholders in Rialto, Amanda is an RN that works at one of the clinics in Rialto. She states there are many unmet needs in the Rialto population, especially with regards to the Hispanic population. She states that over the years she has noticed a drastic increase in the Spanish-speaking only patients. The language barrier creates care and knowledge gaps between the patient and the healthcare professional. Many times these patients will end up being readmitted because they are unable to manage their own care. I've had experience with this before as a nursing student. Um, Glory events coordinator at a local church states that she knows a lot of people who attend the church who can barely afford to put food on the table. These churchgoers are having difficulty managing their chronic diseases. She herself suffers from diabetes and states that there is not enough education within the community. People do not understand what they should eat or what they cannot afford to care. The church does what it can and provides a food bank, but it only operates 2 times a month. The church also provides a senior breakfast once a month. I'm actually going to be working with Glory to provide education to the churchgoers regarding diabetes, stroke, and nutrition. So these are just some people that I stopped in the community. So Monica, I was just asking them how they like living in Rialto, how they feel. Monica said she doesn't really go out at night unless she's in a car. Her parents don't really let her, um, kind of signifying that maybe Rialto isn't the safest place. Stella, 78, she states the city is improving with all the new developments. I think she's referring to the Walmart, um, the new Walmart building and center. But I still don't feel as comfortable as I used to. I've lived here for 50 years, and only within the past 10 years have I had my house broken into. So my my aunt actually had her house broken into as well. I think twice. Chris, 70. I love living in Redlands. There's a great community of senior citizens that have provided support. I had a stroke 5 years ago and would not have made it throughout without their support and the great people at Redlands Community Hospital. This is actually a volunteer that works at our hospital that I interviewed. Cynthia states that she enjoys living in the community because she is because it is very active. She feels like it encourages her to be more active, and there's always someone running or biking nearby her apartment. So reflections. This is actually a beautiful picture of Redlands. Um, Redlands is a beautiful city. I would love to actually live there. Um, it appears that there's more community there. There's a lot more people talking. When I was just driving by, there was people in the streets just kind of chatting with their neighbors. Um, I know that there are like unmet needs in Redlands because I work in there and I see a lot of patients who suffer from COPD or CHF. Um, I felt pretty safe driving around, and I think there's a lot of people walking, so I think I would probably feel safe walking around. I've been in Redlands at night, really no issues there, especially in the area that I was at. And Redlands has a very vibrant nightlife. Rialto doesn't really. People are not really out at night. I don't see a lot of people walking. Sometimes when I do, I kind of get nervous. Um, I mean, I've lived here my whole life, and I've never had really any issues. But I know people who have, and I've had my neighbor's house being broken into, but my house has never been broken into. Knock on wood. Um, I don't mind living in Rialto. It's cheaper. It's less expensive. Um, it's it's also more of my community because I'm Hispanic and I live with the culture shock to move to Redlands would be a little much for me, I think. These are my references. Thank you.